all the teachers, my seniors, organizers, thank you very much for giving me this opportunity. So after the very energetic presentation of Ithiraj sir, he has made my work very simple because many concepts he has explained. But now it's a challenge for me to keep the tempo on. So this is a different perspective because he mostly talked on the pet animals, mainly cat and dog. And this lecture is mainly on the livestock species, but I'm concentrating myself to the dairy animals. And a very important lecture because it will be covering many of the points that today we have covered up, like the animal welfare, like the One Health aspect, like the emergence of the AMR, and most importantly the milk production, economic gains and losses of the farmer and the cattle health. So revisiting the metabolic disorders in dairy animals, nutritional challenges and the solutions. I just want to make it clear that this focus is on the nutrition because I know a lot of learned medicine people are here. The treatment part, of course, they are much better than me. But it's kind of a prophylaxis, a concept clearance, and many times veterinary capacity here. So it will be, I think, because nutrition is generally in the BVSC also and otherwise also, it's not being taken care of that much by even the BVSC graduates. And so my intention is to make some points clear and then, of course, discuss some advanced strategies that how we can go about it. So a very required information is that morning we have discussed that we are the world leader. And all the aspects related to it, we have seen that we are not up to the mark for per cow milk production. But nowadays, some reports are already coming that we are witnessing the emergence of larger modern dairy farms. So if you visit the Punjab, some part of Gujarat, Maharashtra, Uttar Pradesh, I can see the holding of the farmers, dairy animals, they're increasing 10 numbers, 30 numbers, it has been documented. And so it can be said that yes, we have started to keep the very good kind of animals producing very high liters of the milk production daily. Okay. And also now we are witnessing the artificial intelligence. We are having the knowledge burst and we have come up with a very expertise knowledge, and with the technologies, it is expected that we will be further improving our milk production and the quality of the milk production. But while doing this, it's a huge demand on a dairy cow. What we are doing is that without looking into the welfare of the animals, generally we feed them to the extent that they start disorderly terminal acidosis, diarrhea and some other things. But why it happens? Because we want to have a huge production of a high quality milk, a milk of a good quality. We want that a cow should produce one calf per year. We want that cow should be healthy. We also want that we should take care of the welfare of the animals. But while doing this, then it's a duty for a nutritionist to match our nutritional needs, keeping this point into the view. And as you know, that 60 to 70% of our expenditure in any kind of a livestock farming is on the nutrition. So, and when it comes to the dairy animals, the most important phase is a transition phase, and this is what the target of our discussion today. This I have just shown you the ideal production cycle, what we expect from our cow, but it generally don't happen. Briefly, transition period, we know that it is -3 + 3, 6-week period. We also call it as a peripartum period. During this period, there is a rapid increase in the nutrient requirement of the cow, and the milk production rapidly increases. As you see, you are having the high interest cattle, but there is a problem in the adjustment of the nutrient requirements. There is a mismatch, and hence because of that, there are some metabolic disorders that occur. Now this information is very important, and generally we overlook that information. So briefly, if we assume that a very good milk yielding cow is there, she will be given 10 kg of the colostrum per day on the first day, for example, and then 40 kg of the milk per day. In Punjab, if you go, the average milk production of the cow, there you see average is 35-40 liters. This is what my learned friends working in the private industry like Prashant Shinde have shared with me. So if you see that, and if you see the composition of the milk, we can say there is a daily drain of 1.6 kg of the fat, daily drain of 1.3 kg of the protein, daily drain of 1.8 kg of the lactose, and almost 300 grams of minerals per day from the cow. Now this much of a drain, is it a machine or kind of a thing? Okay, so this is what we should get sensitized. And now, with this now we can say that the peripartum period, because of this drain, mainly it is the energy, and there is dry matter intake loss, and because of that there is a nutritional deficiency and negative energy balance. There is a need, this well established phenomenon, probably all we veterinarians and we know. Because of that there is a fatty, non-esterified fatty acid they get from the adipose tissue mobilized, and then there are some of the important metabolic physiological changes that occur in the transition cow, which is a culprit. Because of that many diseases occur, and that we are going to see. So briefly, the physiological changes, we should, this is important, it's very simpler information, but to understand for the slides. There is a growth of the fetus, reduction in the rumen valve because of the pressure, the mammary gland development and milk synthesis more in the last trimester that you know, and when it is a very close to a cow, there is a 40% reduction in the dry matter intake, 40% reduction. When there is a high rate of the nutrition, at that time there is a 40% reduction in the dry matter intake, and there is a dramatic increase in nutritional needs. For example, cow needs 3 times more glucose, 2 times more amino acids. But if there is a feed intake loss, then again it is a excessive burden on the cow. Then there is a beta carotene, vitamin A, and alpha tocopherol that we are going to see, because cholesterol synthesis is very rich source of all these things, and because of that drain, there is a general deficiency, negative nitrogen balance, then inability to increase the intake because there is a leptin concentration high, okay, which again adversely affect the feed intake of animal. Then cows mobilize body resource, then there is an early lactation body weight loss. Then it has been seen that within a few days of the lactation, 20 kg of the muscular tissue is lost, 8 to 57 kg of the body fat is lost, okay, though it's a very wider range, but it's of different kind of animals. And then subsequent important, dysfunctional immune system. We have not taken into consideration much the effect of the transition period and the role of the immune response, because as a nutritionist we have been targeting energy, protein, okay, fats, minerals, but if you see the immunonutrition, that I think it's a field of the focus nowadays, and these are not going much into the detail, but these changes are seen, peripartum changes. Some of the prepartum changes we have seen. Now some of the hormones like insulin, glucagon, okay, thyroid hormones, growth hormones, then some of the endocrine hormones, estrogen, progesterone, all the changes in some peculiar way, which have a direct bearing on the metabolic predisposition of cow to during the transition period. But because this is a bulky slide, I just wanted to have a look on this. What important is the immune status. If you see, there is an immunosuppression. Okay, why there is an immunosuppression? Because there is a circulating immunoglobulins which are diverted to the cholesterol. The infectious diseases like mastitis and metritis, they are very common during peripartum period. The high estrogen and progesterone cortisol, they have a adverse effect on the energy metabolism, and glucose is decreased. Reduced nutrients make intake around the period. When there is a reduced glucose, the immune cells, if you see the neutrophils, leukocytes, macrophages, they have a very huge demand of the energy. Almost 50% of the energy is diverted to have or to evoke a proper immune response. Also at the same time, there is an oxidative stress development that already Athira sir has explained. There is a reactive oxygen species, free radicals that are produced. In response to that, we are seeing some major metabolic disorders. There are many numbers, but what important are hypocalcemia, ketosis, fatty liver, subacute ruminal acidosis, and then abdominal displacement, laminitis, mastitis, metabolic disorder, metritis, laminitis, and many more. Okay, but today, because these 4 are more prevalent in the field and they have major bearing, like a milk fever, we are seeing at milk fever is the gateway of the diseases of a cat. Okay, once hypocalcium is there, be sure that cow is going to suffer from many infectious diseases onwards, and the milk will be reduced. So we'll talk briefly about these 4 diseases. Okay, and then of course we can discuss further. Now ketosis also, we have our mechanism set, and that we all know that the milk production losses because of ketosis, huge milk production loss, then health complications, early culling just now discussed, economic losses, and in India there are few reports, though we don't have a very structured studies for assessing the economic losses because of the metabolic disorders and even for the infectious diseases for that reason. But there are very good studies from the Tamil Nadu state and elsewhere, and they have concluded that there is substantial or a very considerable economic losses for the animals as well as for the farmers. We know that it occurs 2 to 4 weeks. There are different kind of ketosis, type 2, type 1. Okay, so they have different timelines as well, and it is characterized by high ketone bodies, beta-hydroxybutyrate, mainly because it is more prevalent and it is stable. And there are of course acetoacetate and acetone as well, and these are the clinical symptoms that we all know. Probably veterinary officers must be knowing better than the other people. This is just it's a mechanistics that we all know. But what the crux is that when there is a high energy need and low intake, there is a negative energy balance, glucose shortage. At that time, gluconeogenesis occurs. Okay, so no glucose, no propionic acid, and when there are fatty acids available, they will be oxidized in the liver. But when there is a partial oxidation, the ketone bodies will be formed, and this is generally a basic mechanism. And also, if you see, there is a lack of oxaloacetic acid in the hepatocytes. Okay, because of that, the fatty acids are not oxidized properly, and we get ketone bodies. This is what the simpler means. Otherwise, the whole biochemical pathways, molecular pathways, probably that you can go through any kind of review and get that information. Okay. So what should be the intervention strategies now? So for the critical prevention period, we can say that 1 week before and 1 week after the calling is an important phase. Like for example, if some of the veterinary officers are there and they have a farms where the ketosis is prevalent, always you can advise the farmers to look into that, not after it is happening, but 1 week before and 1 week after. And the key strategies maybe we'll be discussing that, elaborating further, that you have to maintain the dry matter intake, because this is the main culprit. Then ensure the palatability of the diet. Then avoid rapid dietary changes, prevent over-conditioning, control periparturient diseases, and minimize environmental stress. Now, over-conditioning cows, if you have a body condition score of maybe on the scale of the 5, if it is more than 4, then your cows are more prone to the ketosis. Okay, because they will have more ketone bodies if they are over-conditioned. Then the environmental stress, that is the heat stress, especially in India, we have a concern, and we will be discussing that in a separate slide. Okay. Now, the fatty acid mobilization control, what can be done to reduce the NAPA levels from the adipose tissues? We have well established nutritional studies have been conducted. Mainly it is in the USA farms, Canada farms, then Netherlands, and few studies from the India as well. But for that reason, you can just advise or keep in mind that some of the vitamins, especially for that reason niacin, it helps to reduce the incidence of the ketosis. Okay, so because it protects the fatty acid mobilization, and in that way it reduces the fatty acid accumulation in the liver, and the ketone bodies are reduced. Okay, so you can sort of supplementing some 3 to 12 gram of the niacin per day to the animals at the time. And also there is a therapeutic application where we can go for some of the gluconeogenesis precursors, like we have a propylene glycol. It's very commonly used in high milk producing cows. Propylene glycol may be daily 300 gram per day for 10 days, or whenever you seems that there is a prevalence of the ketosis, it is a good source of the glucose. Okay, so at that time, even with the combination of the niacin, propylene glycol, and sometimes some of the therapeutic agents like non-steroidal anti-inflammatory agents are tried with a very good outcomes. Then of course bypass fat, because cow is in need of a huge amount of the energy, and when we feed the fat, there is a reduction in the feed intake. It has an adverse effect on the rumen fermentation, so we cannot give huge amount of the fat, and that we all know that fat should be bypassed from the ruminal environment, and generally we supplement. How it's a well-established strategy, and it's commonly followed in some of the states, especially Haryana, Punjab, where we have a very high milk producing animals. Another agent is the choline. Generally, rumen protected choline for the reason is tried, where it reduces the hepatic lipidosis. Then it also triglyceride lead to lipoprotein secretion. These lipoproteins are very important because they take triglyceride out from the liver, and hence fatty liver condition is avoided. And also, you can sort of produce supplementing 10 to 25 gram of the choline per day, and it will thus help in reducing the incidence of the ketosis. This is about the ketosis. Of course, there are metabolomic approaches, there are proteomic approaches, there are nutrigenomic approaches. They all are, in the verge of the scientific interpretations and all kind of a thing. And it's a very happening area, the dairy cow nutrition and metabolic disorders. And I will request all the stakeholders to be in touch with, if it is possible, be in touch with the contact with some of the very good research papers. You will be getting a very good kind of information that can be straight away applied to the field. Subacute ruminal acidosis. This is again one of the very prevalent, because we have seen that cow has to feed a huge amount of the concentrated ration to match the nutrient requirement. Okay, so this is a impaired rumen ecosystem that is pursued in the form of prolonged decline in ruminal pH. So this rumen pH generally we assess many times, maybe in the experimental setup. Okay, but what happens in subacute ruminal acidosis, that there is a decrease in the pH below 5.6, and if it is more than 3 hours per day, then it is declared that the cow is suffering from subacute ruminal acidosis. It is seen that up to 20-26% of dairy cows, they exhibit subacute ruminal acidosis condition, and in that condition there is a reduced milk production, again because decreased efficiency of milk production, premature culling. Now again, pathophysiology will not go much into the detail. I'll just explain what exactly happens in the subacute ruminal acidosis. That there are some rumen microbiological changes occurs where the gram-negative bacteria, they're proliferated. Okay, once the gram-negative bacterial populations is increased and there is a drastic change in the pH, there is an injury to the rumen epithelium, stratified squamous epithelium, and this LPS is released from the gram-negative bacteria. And this LPS or endotoxin, this is a culprit. It gets translocated from the rumen into general circulation, and then it goes to the sensitive tissues, it goes to the liver where it is called the liver abscess, it goes to the extremities, because of that there is a laminitis, okay, and systemic inflammatory changes, release of the pro-inflammatory cytokines, acute phase proteins. This is all what happens in the subacute ruminal acidosis that I have explained in some of the forthcoming slides, but I am seeing 1.29 minutes only remaining. So, this for me, sir? Okay. So I have all this discussed. There are some good interesting points I have given in my write-up as well. Okay, I have talked about acute phase protein. This is very important because you must be knowing that some of the acute phase reactants like the haptoglobin, celluloplasmin, and then C-reactive protein. Okay, these are the positive reactant proteins which are secreted from the liver and causing all the inflammatory conditions. Okay, straight away I can go to the nutritional aspect, which are very applied, and you can I think in this slide see what can be done. Allow proper adaptation of the ruminal mucosa and the ruminal microflora in the peri-parturient period. Generally, it's a practice to give abruptly a huge concentrated ration to the animals, rather than you try from 2 weeks before the parturition and get the ruminal microbes adapted well. Then keep the ruminal pH in physiological ranges. Okay. Now, how it can be done? There is a provision of the buffer feeding, sodium bicarbonate, maybe 100 to 150 grams per day. Incorporate physically effective fiber. Now, this is a neutral detergent fiber. You people can easily get an access or information from any nutritionist how much should be the fiber content in the diet and how we can go about it. Even the chewing. Once chewing is there, saliva is secreted. So it's a good buffering agent. And kind of things that I have already talked about it. So I have to cover one hypocalcemia. This is also I will cover in one slide, or I will not explain, but just I will brief you. Okay. So generally we say that a calcium level decreases in the blood because there is a colostrum synthesis and huge amount of calcium. 23 gram of calcium on the first day is excreted out of the cow. Okay, and now what happens is that during the peripastoral period, we feed sometimes high amount of calcium where the parathyroid gland is inactive because of high calcium. And when there is a need of a calcium in the body, at that time parathyroid gland is inactive already and it cannot respond properly, and hence the calcium cannot be resolved from the bone into the blood, and this produces the hypocalcemia and the disease occurs. It is a multifaceted. Okay, calcium involvement in the immune response, in the muscle contractions. So that's why I'm saying it's a gateway of the diseases. Mastitis, then abomasal displacement, metritis, all kind of conditions are related to the hypocalcemia. Unfortunately, time is very less or whatever it is, but this decad balance again, dietary cation anion difference. Okay, I think this is the most important factor which all of us or practitioners or nutritionists should consider. Many products have come up. India has also come up with a decad formulation. Even NDDB is practicing it. Many private companies, they are following such kind of a supplementation of anions. But when we include anions, it decreases the palatability, it decreases the dry matter intake. But we have come up with some of the solutions we are having. So that kind of the practices needs to be followed. So again, not going into the detail, but the dietary cation anion difference, it should be negative in the prepartum diet. It means anion should be more. Sorry, sir. Okay. So these are all strategies I think I have tried to discuss. There are very interesting information. Probably you can get it afterwards also. Then some of the IVRS studies we are also working on. The peripartum cows, we have got some herbal preparations. They are very, very effective. I will take 1 minute on this. I have to take it. We have come up with some of the information in the specific ratio that are not being disclosed now, but have improved feed intake in the dairy cows. Then all the oxidative antioxidant indices were very positively influenced. Immunoglobulins, immunity parameters were very positively influenced. And further studies are going on, and we have a series of studies conducted in IVRI by learned researchers. Then heat stress is again one of the culprit. My friend is going to talk about it, how it affects to the metabolic this thing. And also we have my NSF project was there on the minerals, and we have come up with some very good formulations to reduce the heat stress in animals that can be very well applied in the metabolic diseases management. Now, sir, one more minute, please. How we can conclude is that the transition period demands metabolic adaptations. There is a nutritional stress. Generally, we have to now concentrate on immune disorders. The immunomodulatory agents in the diet should be looked for. It's multifaceted strategy, not only the energy and protein, but there is a fatty acids, there is a choline, niacin, and many other things. And doing this again, the morning there was AMR was discussed, because when infectious agents are there, we have to frequently use the antimicrobials and antibiotic. And nutrition have a very big role that needs a separate lecture on it, but an antibiotic use can be considerably decreased, and thus it can contribute to the AMR issues. And yes, dairy animal welfare issue can also be tackled. What is the future outlook is that we have to integrate feed additives. If you are in the touch of the literature, you will get an idea what kind of the feed additives are there, and nutraceuticals for immune enhancement, and we have to develop innovative nutrition strategies. It's a continuous process. All are working towards that, including the commercial firms and government organizations. And I think these tagline, the healthy transition and health improvement and productive lactation. This is what can I say. Thank you very much for your listening. Correct, sir.
Thank you, Dr. Yadav. Dr. Yadav has given the